Hi, it's Dr. Donahue. So I had this download this morning. So I wanted to pop in and talk about the truth is that people don't know where to start in their health. They hear all these, they go to the medical doctor and you're not actually getting the results you want. And you show up and you get your basic labs done from your primary care physician, right? And as a naturopath, that's so important. However, oftentimes the practitioner will look at your labs and say, everything's fine. You're in there 10 or 15 minutes. I have no judgment. I love my practitioners. I work with them all the time. This is their knowledge. This is what they know how to do best, right? So as a naturopathic doctor, and I want to tell you my story for those of you that are not familiar with my work and are new to me. So my story goes like this, and this is why I can support you. I was severely depressed with horrible menstrual cramps when I was 15 years old. And when you're 15 and 16 years old, you should be going out and having an amazing life and enjoying all your friends, playing sports, which I was, and not super struggling with anything, right? You should just be like living your best life. Instead, I was struggling with my health and I was struggling to stay on track with my health. So I went into a depression, had no idea that my health was connected. And so when I went to my doctor, they wanted to prescribe the pill. So I went to the gynecologist because my menstrual cramps were so bad. And I thought, what's the answer here? So they prescribed over-the-counter birth control pill. I looked at it and I thought, So I think I took it for 3 or 4 days and I got massive bloat, which many of my patients come in with, right? So then I continued on and I thought, well, this is super interesting. Like, I still don't feel my best. I'm going to go back to my pediatrician. No answers. So my mom was a mental health therapist. So at this point in time, she said, let's go see a psychiatrist. You really need support. You're really not feeling your best. And what I would do is I would like muster up all my energy throughout the week. And then on the days that I was not I had energy and whatnot, and I could get up and go and move, it was because I slept through the weekend, right? So I used up all my energy and then all of a sudden I would crash. So this went on for years. So she's like, let's go to a psychiatrist and let's get you some antidepressant. Okay, no problem. Let's go get an antidepressant. I knew that wasn't the way I wanted to go, so I went anyway. And welcome all of you that are jumping in. Please let me know where you're coming from. I would love to know. So here I am at the psychiatrist, and she's this little petite Indian woman, super sweet. She did psychiatry for my mother's patients, who is a mental health therapist. And she said, here, take Zoloft. You're going to feel better. And I thought, I'm going to take a pill to feel better? No, I don't think so. It just didn't make sense to me. So I continued to search for over 10 or 12 years because I am committed to figuring out what's going on with me, which makes me superior to doing what I do with no ego. But I'm going to dig and figure out the root cause of your challenges. So here I am, 15 years old, now 25. I see a naturopath, changes my life. Keep in mind, I struggled with weight. I was heavy. I had no idea it was related to food. Nobody talked about that. Nobody talked about whole food nutrition. We ate from a garden. My dad always brought home quality beef and pork at the time. And we ate fish, and we always had whole foods. And a treat for us was, those of you that remember those small box cereals, they may still be out there, I just don't eat them anymore. When we would go camping, I had 2 older sisters. We would each get to choose one sugary cereal. You see, I wasn't raised on processed foods. So the fact that I struggled with weight and didn't know what to eat and didn't know what to do brought me to where I am today, working with amazing leaders and high performers, and at my clinic here, helping people get and create health. But why it was in my heart to support all of you today is because so many people come to me, or they'll call, or they'll jump on a call and they'll be like, I just don't know where to start, because I go to my primary care physician and I sit in his or her office, and often it's not even a physician now, it's a nurse practitioner, and they look at my labs and they tell me I'm fine, but I leave there and I know I'm not feeling my best self. I know that I can do better, but I'm trying to do all of these things, but nothing seems to be supporting me. And so my gift is to really acknowledge the confusion in the patient and get them on a really healthy trajectory. So the medical world, as we know it, is you go in and you get a pill, and that's what they know. But let me tell you what, if I walked out of my clinic right now where I am and I got hit by a car, then I would want the hospitals to take care of me. But for preventative health, their gift isn't as strong as our gift as naturopaths or functional medicine practitioners. If you look around, look at the statistics of the medical doctors that are choosing to learn about nutrition. Because the truth is, in their training, they learn from 3 to 5 hours of nutrition, which for the most part is the foundation of our health, right? Though there's a little bit of skepticism around that, but I do know it feeds us the nutrients we need. The challenge is epidemiological studies aren't as strong around nutrition. So each person genetically is a little different when we're looking at what your macros are. Many of you know 3, and the fourth one is alcohol. So our macros are protein, carbohydrates, fats, and then alcohol, because there's so much alcohol that's consumed. So we're looking at that. And for me, I figure out what works best for your body. Because just because Sally and Mary and Joe are doing this diet, or they don't eat grains, or they do great on quinoa, doesn't mean that that's going to work for you, right? So I want to share some statistics before I dive deep into where to start. My goal as a naturopath is to heal chronic disease patients at a time. Patients, group patients. Do you know that 6 in 10 adults in the US have a chronic disease? From diabetes to chronic fatigue syndrome to fibromyalgia to Lyme disease to co-infections with Lyme disease, Borrelia, Babesia. Like, there's so much chronic disease around us. Then we've got all the cardiovascular disease that so many people struggle with, right? So regular blood tests can't help with early detection. It can only help when you're in an emergent situation. So my goal is always to teach, what can we support you with to know the early detection? Heart disease. Do you realize that heart disease is the leading cause of death globally? Regular cholesterol and other blood tests can help assess the risks, but yet there's so many more specialty tests out there. Like, one of them is Clearly, Cleerly, where they actually go in and they look at all your arteries, and AI reads them, and then you have a risk for the actual, black widowmaker, which is the one that can kill instantly, the heart attack that can kill instantly. What sort of plaquing is in your arteries, right? So I don't know about you, but I'm clear that I'd like to get that complete as I age. So lack of some of these quality tests that I'm going to talk about are early warning signs, and it can help with our deaths. So if we don't have these early detection tests, we could lose about 17.9 million. Like, I pulled up the statistics today from cardiovascular disease alone. Many of you know, like, this talk, I work really hard with diabetes and insomnia, like sleepless nights. Do you know there's 40 to 37 million people in our world that have diabetes? And now, like, there's a huge percentage in teenagers. I don't know about you, but that super scares me. It just makes me sad, The other statistic I read that has not necessarily due to diabetes, but it does have to do with our chronic diseases. 1 in 4 teenagers are now thinking about and or committing suicide before they even get to be an adult. Like, come on, like, we get to change our world. So diabetes management, if you do regular glucose monitoring testing, like you go in like every 3 to 6 months or yearly to look at particular markers like hemoglobin A1C, I do look at insulin, I do look at glucose, and over a certain period of time, I watch the pattern. So I have a woman that I'm working with right now, 83 years old. I asked her to bring in our old lab results, and she's been pre-diabetic for the last 5 years, and nobody has ever talked to her about it. This is a problem. And then when she called to talk to her primary care, who's our nurse practitioner, basically, she said there's nothing to worry about. And her kidney numbers were decreasing. Like, just because you're older doesn't mean that you don't get to have quality health, right? So we can help with the risk of diabetes. Do you realize, like, vision loss, kidney failure, increased cardiovascular disease, these all come hand in hand with diabetes, which is sugar, high sugars in the body. And if we learn to eat what works best for us, this is where we get to start. And be familiar with how much sugar, how much starches can your body actually handle. Half the time the irritation, the agitation, those sorts of things that are happening in your life, or the anxiety and or depression, that highs and lows that you all hear me talk about, that 100% could be related to blood sugar. And I will tell you from the bottom of my heart, when I work with patients, until I get their blood sugar in check, can I look at other numbers? Because high blood sugar causes inflammation. And I believe a lot of our processed foods and our high blood sugars are causing inflammation in our bodies and are not allowing our bodies to heal. You see, the body needs to rid itself of glucose. Liver and kidney function tests, when we look at an average of individuals. So 1 in 10 people have some form of liver disease, and 1 in 7 adults suffer from chronic kidney disease. So if you go and you have your regular blood tests done, we can actually help with late onset or early onset, before it gets too late. You see, the medical world isn't going to look at it unless they actually have a reason that, your kidney is in failure or your liver enzymes are highly elevated. So when your liver and your kidney get more elevated, then it's more complex, and then the treatments aren't as effective. Nutritional deficiencies, if you're not eating whole foods and you're ignoring regular blood workups, then you could be actually in vitamin and mineral deficiency. So here at the clinic, I actually test vitamin mineral profiles, and I look at your nutritional deficiencies. Are they 100% accurate? Probably no. There's limits to all the tests that we actually do. But when I do them with patients, they start to feel better. Even cancers, certain types of cancers can be detected through blood tests. So, early detection is key to most of these diseases. And the last one that I want to talk about is infection control. So lack of certain blood work may be missing infections. I can't tell you how many patients have come into the clinic, female mainly, who have urinary tract infections and had no idea. They have no burning, they have no pain with urination, they have none of these symptoms. But I look at the test, I look at the urinalysis, and I'm like, do you realize this has been ongoing? They have no idea. So when we do these early detection tests, this is where we get to start. So the misconception about health right now is we're living in a sick care system. We're not living in a healthcare system. We're doing the best we can, but it's really not good enough. And the foods that you buy in the grocery stores, And the processed foods, like I tell patients to shop the outer perimeter of the grocery store. Think about that. What is in the outer perimeter of the grocery store? Whole foods. You get your fruits and vegetables on one side, you get your meats on the other side. If you're a yogurt, milk, and egg person, you get that usually in the back. And the only time I tell patients to go in the center is if they want to get a quality bread or quality like rice or quinoa or dried beans or, whatever that looks like, but stay away from the processed foods. So I want to share with you from the bottom of my heart. I know how frustrating it is from me doing it myself and going from doctor to doctor to doctor and not getting the results that I desire. And just like for 10 years, I struggled. And it was when I found a naturopath that they could actually look at my whole health and they actually walked with me on my journey. And that's how I got here today. Doing what I do, doing what I love, walking with you as leaders and high performers through your health. So, you don't want to go to, you don't want to go to a personal trainer and not build the muscle that you want. You don't want to hire a business coach and not get results in your business, right? How frustrating is that? You pay this money and you don't get results and you're not sure what to do and you don't have a plan that works for you. But the bottom line is when we work with you, we're creating a plan that actually fits you. Because feeling stuck and overwhelmed in your health and knowing that you don't feel your best is 100% frustrating and it's overwhelming. And you say to yourself, I own my business or I am an executive and I have a busy family. I don't have time to sit in a doctor's office to just be told that I feel okay, right? So none of us want that. We want to go and have the courage to take control of our health. And that's why I'm sharing this with you today, because it has been a pattern over the last 3 years, really are living in a fearful state. And they want to take control of their health, but they just don't know where to start. And I still have people calling me saying, what is a naturopathic doctor? What do they do? How can you help support me? And then when I walk with my patients on the journey, it makes like a huge difference. So I encourage you on so many levels to realize that how you're feeling is real. And I have empathy for you. Nobody knows it's more real than what you're living, but I want to ask you, how much longer do you want to suffer in pain? How much longer do you want to wake up exhausted or not sleep at night? Or not even know that you have a blood sugar challenge or not even know that these symptoms are related to that? The patient that I talked about earlier with diabetes has come in and she's lost like 12 pounds. It's not about losing weight. Yes, many of us are like, let's try this like diet. Let's try this nutrition plan. Let's go keto. Let's go vegetarian. Let's go vegan. The key is to figure out what works for you and to know what your weaknesses are. So getting your date, having the courage to go in and get your basic labs like a CBC, a lipid panel, a complete metabolic panel, which will look at your kidneys. It's going to look at your liver. It's going to look at your calcium, your potassium, your liver enzymes. A CBC is going to look and see, do you have any infections? I know a lot of you may not know what this means. Look at your iron. Do you have low iron? Is that why you're tired? Do your red blood cells look good? Like, this is so important to get this done. But in context to that, if those are all normal and you're not feeling like your best self, there's so many quality special tests out there. I can't tell you how many patients are suffering with bloating. The first thing I do is send them off for gut testing. Let's look at your gut. Let's look at what's going on with your digestion. Let's look and see how your microbiome is. Because the truth is, if you're not thinking and feeling like your brain is working at the capacity that it used to work, there could be a challenge in your gut. So this is why I encourage testing, so that we have valuable information. In order to know where to start, it's so important to connect with an individual like myself so that I can walk you on that journey. You know, when you have a target in business, or when you have a target, say your child plays baseball, what do? You often hire them a coach, or they have a coach. And if they're really wanting to level up, then you're going to hire them a coach that's going to help them level up. Your health is no different. It's absolutely no different. So when you really want to dig deep, we get to look at valuable tests that will help you get there. So I want to debunk the myth and the misconceptions that lab tests don't give us the information that they actually need. That they don't give us information. They do. They give us valuable information that will help us get to the end goal. And if you're still experiencing the symptoms when you're working with a practitioner, like a functional medicine practitioner or a naturopath, then we are figuring out what tests work best for you. Like, what test will be the best fit for us to get the answers that we need. I remember, to this day, I want to share with you, I have an amazing mentor who's near and dear to my heart and is pushing me in my business because I have a dream to heal chronic disease. How many of you have a dream in your life, but you're just not sure how to do it? Like, maybe you want to start a side hustle. Maybe you know that homeschooling is like what you want to start teaching. Maybe you're tired in the job that you're in and you want to change it. Is that any of you? Because getting in the rooms with people, just like I do when I do my continuing ed, I show up and I get in the rooms with doctors that I know are going to teach me what I get to know for all of you to help support you. Business is no different. Do you have a huge vision, but you're not sure how to get there? I am going to an amazing event in November that I want to share with all of you. And I'm sharing this around health because when we know our vision and when we know where we get to go to, it's so important that we get to go there. So I put in the chat the zone event. It just came out of my brain right now that I get to support you with it, because if you have a vision, get in the room with over 3,000 people. I will be there, and I want you to be there with me to help us all up-level our health, our business, and our life. Because the truth is, we don't have to go at life alone, right? So when we go at life alone, it's like, let's go somewhere who's already done it before, right? That's the same way with healthcare. Let's go there because somebody else has been there, right? And so I just wanted to share it with me. It was just near and dear to my heart that Shanda Sumter is an amazing, amazing teacher and leader. She has a heart of gold, and she wants to see all of us rise. So I wanted to share that with you, because this is a discounted offer, and it's not about the offer because I'm going to be there. I'm just sharing it with you because it's so near and dear to my heart, and she's an amazing person. So let's continue here. So when we look at whole health, we're looking at, and everybody talks about this, so I kind of want to break it down for you. Your physical health, your mental health, your spiritual health, and your emotional health, and the relationships in your life. Talk about, you are equal to the 5 people you hang around most. Hence why I brought up Zone Event. I am surrounded by leaders and high performers that are making massive changes in this world. Massive changes. And I want you to be one of them, because you get to make changes not only in your health, but in your life. And when you get in the rooms with these people, your minds pop, your energy pops. Maybe you're feeling like you're just not sure where you want to go. So creating whole health is eating whole foods, having really great relationships, but also knowing where your lab values are. So myself as a naturopath can take you to the next level. I can't take you there if I don't know your statistics, or I don't know anything about you. Right? But like when we meet and I do iridology and pulse diagnosis and I evaluate you as an individual, and then I say to you, let's evaluate these tests based on your symptoms. Man, are you struggling? Let's look at your hormones. You appear to be super stressed. Let's look at a hormone test. I don't want to call out specific tests here. I did in the beginning just because it's a specialty test that many people haven't heard about. And if something's working, let's utilize it. It is real that you get to live in paradise. You get to live the life full of vitality and full of energy in an arena that works for you. So creating a system, creating a plan, creating whole supplements, foods, nutrition, relationships are so important to you. So finding tools and strategies and mindsets, this is real. Health is going to take work. Just like if you started your own business, like I did close to 15 years ago, and I'm surrounded by several entrepreneurs, do you think I walked in my clinic right away and everybody just kept coming? It took work. It took energy. Right now I'm doing 75 hard. And I am super excited. I believe I'm on day 59 or day 60. And there's some days it throws me out of my game. So for those of you that don't know 75 hard, you can Google it. But one of the most challenging things for me is 2 workouts a day. I always do 1. But last night I did it in a thunder and lightning storm to get my second workout done because I'm committed. I want to change the trajectory of my life, and I want you to change the trajectory, because every day we can get better. But if we are feeling like exhausted and we can't get out of bed and our energy is low and we're just not getting to where we want to go, there could be a condition that you're suffering with that's undiagnosed, and you might be so frustrated that you're not getting the answers that you need. And so this live is all about where to start. There is not one nutrition plan that fits any of my patients. We tweak it. Some patients need more carbohydrates. Some patients need more fat. Most people, not everybody, don't eat enough animal protein. They just don't eat enough animal protein. 100 grams is minimum for adults. But if you weigh 200 pounds, 100 grams is only a half. So figuring out where your nutrition is and really creating a lifestyle that works for you as an individual. You see, as I up-level and rose in my business, I didn't try to go at it alone. I'm working with an amazing mentor. I want you to have that life as well. You get to have it. So again, I've put the zone event where all of us are leaders and high performers in there that are going to be showing up. And I can't tell you how excited I am. And so you say to me, like, Dr. Donahue, what does this have to do with health? It has to do with everything, because how you do one thing is how you do everything. 100% is possible 100% of the time, but you have to want that. You have to want to have health. If you come in and say, I just want to take a supplement for depression, I'm sorry, it's not going to work. Because the truth is, so many practitioners are still prescribing a pill for an ill. It's just a natural pill. They're not really getting to the root cause of what's going on. And it's the courage and the motivation that you sense in your heart, that you know that you can get better, because you can get better. You can get better. Those of you that are with me right now and listening to this, God put us on this earth to be well and abundant. He did not put us on this earth to be sick and not be in community. So the more connected we are in our life and make changes, this is my goal, to heal chronic disease. So, daily blood work isn't necessarily what most individuals do. I'm not saying daily, that came out wrong. 3 months, 6 months, 9 months here. So when I'm wanting to follow up with a patient, if you go to your primary care or your nurse practitioner, you're most likely only seeing them once a year. Do you think that's going to bring you health? Are they there supporting you, edging you on, connecting with you, really caring about how you feel? I know they care. It's just their training. So, but medical checkups and lab evaluations, like I talked about in the beginning, play 100% vital role to preventative medicine and preventative. So the earlier the detection of many of our chronic diseases and even your potential health issues, help with a timely intervention and better outcomes. Like if I caught you now with prediabetes and I looked at your labs, then you're at a lower risk for all the conditions that we spoke about earlier, like vision loss, kidney failure, neuropathy, not being able to feel your feet, like feeling like you have gloves or mittens on, kidney failure, cardiovascular disease. Because if we stop it early enough, the risk of turning it around, or the benefit of turning it around, is 100% there. So medical support for blood work and lab evaluations for me is tailored to you as an individual. I tailor it to you. So depending on what your symptoms are, depending on, what works best for you, like where your lifestyle is at, that's how I create your treatment plan. How would you feel, for those that are on live with me right now, if you had me in your pocket? Like you could listen to my voice, you could listen to my energy, you could hear what I want to talk about every day, because I wake up and I think about you. I think about how can I take you out of the emotions that you're in, the inability to get out of bed, not having the vitality, not having the drive or the libido that you're used to having. Like I think about you and how can I support? So one of the ways that I support is through Pocket Doc. So many people are getting like such aha moments when they listen to my messages, because I'm literally leaving you a message a couple times a week and you're hearing it. And then what patients are doing, they're like, oh, I never thought about that. Like I was talking to an individual the other day who's listening to this, and she said, I never really thought about when I was stressed out and overwhelmed at work, of course, when the weather's nice out, that we're not looking at snow, that I should go out and take my shoes off and ground and walk in the grass. Or that by going to the beach is like grounding for me. Or that I should stop and breathe. Like she has breathe on her computer so she doesn't forget to breathe. So these are all the messages that I put together for you, because you don't know where to start? Well, start by listening. I know I listen to a tremendous amount of podcasts, or I read books, so that I get to learn like what questions to ask. How do I advocate for myself? Because clearly when I was 15, I didn't know how to advocate for myself, but I knew there had to be a different way. If any of you that are on that have questions, please drop them in the chat. I'm happy to answer them. Having the courage to take control of your health. I can't stress that enough. Having courage to make the phone call, or to ask for the referral. Maybe you see a friend of yours who has been doing amazing things and feeling great, or maybe it's a family member. Maybe you want to ask, like, what have you been doing? And I'm not saying do what he or she does, but maybe reach out to that practitioner. You can always reach out to me. You all know where I am. All my information is around the board, and I want to heal you and get you out of this disease state and get you into metabolic health. Do you realize the importance of having more muscle on your body helps you with your metabolism? It helps you burn glucose. Like, these are the messages that I drop in Pocket Doc on a daily basis. And then once a month, you have questions? Jump on, ask me questions. So I just kind of want to recap what we just went over. One of the main things that I want you to think about is not only doing your yearly labs, but get with a practitioner. Again, it can be a functional medicine practitioner. It could be a naturopath. There's a lot of DOs out there, doctor of osteopathic, that really want to do preventative medicine. Maybe it's a chiropractor, a Chinese medicine practitioner, an acupuncturist. I don't know, whatever your energy is drawn towards. But make sure that you're getting labs for yourself. Maybe it's mammograms. Maybe it's MRIs on your breast. Maybe it's early detection, because I know the earlier that we detect a condition that's underlying in your body, that's preventative, because we can hopefully heal it. I'm not making a claim to that, because I don't know those that are watching what they're struggling with. But the earlier detection, even in cancer, the statistics are like stage 1, stage 2, you have a better risk ratio for survival. Every cancer is different, so I can't throw a statistic out there. But what I know is early detection is key to any chronic disease. Knowing that high lipids are related to sugar. It's not related to fats. When patients come in and they